be a superhuman parent to cope with all this.
We used to describe him as the energy bunny that kept going, the Duracell bunny. Yeah. That is what Dylan was like, first thing in the morning to the last thing at night.
You keep telling somebody, oh, you're bad, you're bad, you're bad, or you can't do this, you can't do that, they're going to think that.
Because you do get family members that just say, no, it's just naughty, he needs a good slap.
The MPs and people like the Health Minister, they want to get down there and see what a family has to go through. If they live with it, we might get something done about it.
ADHD.
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 As quiet as we've been all year.
It's come up to 12:30.
Is it 12:30? See, I'm dying for a cup of tea. I knew there was something.
At the end of the day, I'm a good parent. I do my best. If I'm not doing the right thing, I put my hand up, I get support.
My son's primary school, the Senko teacher thought he was just an naughty kid. When we got the diagnosis and a letter, I showed that to her and she had to apologise.
Our kids are loving,
Clever.
talented.
Yes.
Eloise is very gentle and
Very,
loving.
very gentle. She is very empathetic with young children.
We need to know more about the good things about ADHD.
Well, give Joanna time to think. You pressure her sometimes.
I'm a mother, I'm a daughter.
Why does society generally only look at the negative side to ADHD and its financial cost to society? Why not? Why doesn't it look at the positives?
Hi, I'm Marcus, I'm from Warrington and I'm 11 years old.
I'm Janine, I'm 45 and I'm from Wellingborough in Northamptonshire.
I'm 45. I'm not quite sure.
Just don't, you won't be bored today. No. Okay, Marcus, what does ADHD mean to you?
I kind of think of it as like a superpower. The majority of the time, like, it helps me think outside the box and stuff, so yeah, it's good.
There are definite strengths to having ADHD. I'm massively creative. I have so many ideas. Some of them are really rubbish, but a lot of them are really, really good. My medication definitely helps. But so does being sort of calm and happy within myself and having people around me that understand me and accept me for who I am.
We're not just naughty, we're just kids with like behaviour problems that sometimes can be used for good.
I wasn't diagnosed until I was 41. My parents were told, and I was told, that I would never amount to anything. But now, what I would say is that I remember that and I kind of have a bit of a stuff you attitude to it, so I'm like, no, actually I'm going to prove you wrong.
I don't make comments about kids with ADHD, mad, bad or sad. Them labels just stick with us.
What would you like to say to those people?
Just bog off. Don't be mean about us kids with ADHD, bog off. What does it feel like to have ADHD to you?
Like a bubble gun going off in my head. Literally, from the minute I wake up to the moment I go to bed at night, literally a bubble gun of ideas just going and I'm supposed to try and grab some of these and do something with them. How does your ADHD feel to you?
So it feels like I'm in a room, like, and there's loads of thoughts whizzing around my head like a rocket, and like I'm in a room like with loads of people talking. My dog's running around barking after his toys, and someone's got the like television remote, and like I can't make up their mind what they want to watch. And then someone's trying to get my attention, and I get upset because like I can't filter out what they're trying to say to me.
Yeah, that makes perfect sense. One of the things that's impossible for other people to appreciate is how much effort we're having to, and like if there was lots of noise going on here and I was trying to listen to you, I'd be going like this, trying to tune into you and trying to push everything else out. Do you like school now?
Yeah.
What's the best bit about school?
Having loads of people around me that I can trust and that I can talk to and know they won't go off like spreading gossip and stuff.
Do you feel like you've got people on your side now?
Yeah.
It changes everything when it's like that, doesn't it?
Yeah.
Yeah. What do you want to do in the future, Marcus?
So I'm quite good with computers, maybe professional gamer, YouTuber, and maybe go to space. I don't think that'll happen. Or maybe skydive. Can we bring Coco on now? You want to be famous? There he is. So this is Coco, who's my service dog. Like when I'm feeling upset, like he'll come and give me hugs. Ooh, wriggling. We want to like raise awareness, like, and make people know that not all kids with ADHD are just plain old naughty.
And I think for me in particular, because I'm an adult and I'm a professional, because I have my own home, because I am happily married and all of those things, these things are things that are possible with ADHD, but it isn't what people think when they find out that somebody has it. But the reality is that if you work with it rather than resisting it and denying it and hating on it, it's a superpower.
I do these talks and like do stuff like this so that other kids know like how to deal with it and what it's like, and that it's not all negatives, it's actually quite positive.
Don't think that it's the end of the world, because it's not. It's just the beginning of a new one.
Yeah.
Now, some of our parents go through an awful lot of trauma, thinking, do they want to put their children on medication or do they not?
Don't you think it's a really poor thing though that the first thing
they say is medication?
It's not cognitive behavioural therapy. That was never offered. Why is it not there as well as the medication?
It should be in conjunction.
Has anybody been offered anything but medication?
No. Just medication.
What is the alternative to medication?
I want to see, are there alternatives for him? Because he's not coping on his medication. So is there an alternative?
I'm Dr. Anna Conway-Morris. I'm a child and adolescent psychiatrist and I specialise in ADHD.
Why is it always medication first?
Usually, especially in younger children, parent training and support should be offered first line. And then if that doesn't work, or if the symptoms are pervasive and severe, so they go on for a long time and are causing a lot of problems at home and at school, then medication should be considered.
Now, some of our parents go through an awful lot of trauma, thinking, do they want to put their children on medication or do they not?
I'm a parent myself, and I think putting your child on any medication, giving your child any medication, is always a big decision to make. The most commonly prescribed medication is methylphenidate, which is colloquially known as Ritalin. It is highly effective for the symptoms and signs of ADHD. It doesn't work for absolutely everyone, but if you have severe symptoms of ADHD, you will, and you respond to methylphenidate, you will notice a marked difference. Every medication comes with side effects, and of course the child has to take them regularly. One of the things I notice in the treatment of ADHD is that young people are often worried about the stigma of having to take medication. And for ADHD, they maybe don't want their friends to know.
Don't you think it's a really poor thing though that the first thing
they say is medication?
It's not cognitive behavioural therapy. That was never offered.
In the NHS, the general practice is that cognitive behavioural therapy is not used as a first-line treatment for ADHD. It is sometimes used as an adjunct. However, many children with ADHD do struggle with other mental health problems such as depression or anxiety, or have other neurodevelopmental disorders such as autism, for example. And these children, if after a trial of medication with ADHD, if they still have symptoms, then cognitive behavioural therapy can be useful.
Is there an alternative?
Regular exercise for children with ADHD comes highly recommended because we know that children with ADHD have an excess of energy, and if they can exercise, that often makes them feel better. There is some evidence that meditation and mindfulness can help young people to relax, especially in the evenings. In order to help your child wind down at night, it can be helpful to have some sort of relaxation method as part of your bedtime routine. If a young person has been through several courses of different treatments and they have not been effective, then I think there are two things that need to be done. First of all, the history needs to be looked at again and the symptoms need to be looked at again. And certainly if I was a parent, I would at that point probably ask for a reassessment to see, is this diagnosis 100% correct? Are there other things that are making the treatment difficult? And then certainly in a situation where medication has not been completely effective, cognitive behavioural therapy is recommended in the NICE guidelines.
Why can we not get a diagnosis within the 6 weeks? Why do you have to wait 6 months to a year?
Getting the label has been very difficult.
We want labels, we like labels.
The label enables him to get the support he needs and the right score, which we've now got at 7. But that's a long journey from 3.
We need that label because we need the support.
Absolutely.
And because you don't get the support until the need is labelled.
The diagnosis as such requires the symptoms to have been present for more than 6 months, and they need to be stable across different settings. So for the diagnosis, you always need information from home as well as from school. These are the questionnaires that the parents are talking about in the group.
The paperwork, it's like, the tick sheets you've got to fill out.
The questionnaires are
oh my God, it's horrible. When you sit there and you go through that paperwork, and it's just like, oh my God, I'm the worst parent in the world.
Yeah.
What is wrong with me? Why can't I control my child?
I agree. The questionnaires are quite complex, as in they go through a lot of questions, and many services use more than one questionnaire to gather information. That can be quite a confusing process for people. On the other hand, the quality of the information that you get is really helpful when you make a diagnosis. So a child who is anxious might come across as not paying attention or not listening, but this child might not have ADHD. It's really important to get the diagnosis right.
Why do paediatricians and schools not have a simplified route? Why is there not a clearer pathway of diagnosis?
It is about a pathway. Why is there not a clear pathway towards intervention for ADHD?
That looks to me like a very complex process. Would you agree?
Yes, I mean, I think the pathway for accessing diagnosis and management of ADHD is quite complex, simply because the disorder as such is complex, and because it takes a specialist to diagnose it.
It was 3 years. 2 years.
4 years.
A year and a half.
3 years.
Delays are often introduced by the fragmentation of services. So, you know, as a parent, you might wait for your child to be assessed by the specialist teacher. Then the teacher might say, actually, I'm a bit worried about your child's sleeping pattern as well. Maybe you should go to the GP. You might wait for a GP appointment. The GP then thinks, well, there is a bigger problem here. Let's involve the community paediatrician. You know, then you will go to this clinic, and then many community paediatricians might be confident making a diagnosis of ADHD, but some of them do not themselves, for example, prescribe methylphenidate, and you might then be referred to a specialist service. And of course, these steps in the care, this stepped care approach, can introduce some delays.
When I went to my son's exclusion meeting, the school brought up, we offered her a parenting workshop, but she declined. And I told her and said, well, I was highly offended that you think I need to go on a course to be told how to be a parent. Yes. One, when your teachers are ringing me up and asking how to deal with my son.
Parents often feel that they are criticised for their parenting. Actually, parents with children with ADHD are often very good parents, but Managing the behaviors of a child with ADHD is different from normal parenting. It's much more challenging. Accessing parent training or parent support is not something to be ashamed of. Quite the opposite. I think it's an important part of being a parent of a child with special needs.
I have a son, Dylan, who's 14, who has ADHD and ASD, and he's been excluded. He got excluded from his last school.
The trouble is with secondary schools, their priorities are different to primary school. When the child walks in year 7, the expectation is that they grow up, they become independent, they think for themselves, they organise their own lives. Our children can't do that. And they need support to do what secondary schools require of them.
Primary school, you can get all these interventions, but why does it fall apart when it gets to secondary? What is that in between? Why?
Hello, welcome to Rainford High. My name's Ian Young and I'm incredibly proud to be the principal of this school. So we're all right, ladies? As a school, what we're trying to achieve is we want everybody to be welcome. When I arrived as the head in September 2012, we weren't a school that was overly inclusive, I didn't feel. We'll take you to the school library. What we discovered was there was a need to try and do something positive around ADHD. Young people who have this condition, you know, how it affects them, how it means that they learn maybe slightly differently to other people in the classroom.
I think it's really important to normalise that it's not a bad thing to be different, and it's about just making sure everything is as accessible for everybody as it possibly can be.
So this is sort of the main corridor where we have learning support. This is one of the areas where those children would find support, maybe quieter time. We're trying to make life better for all the students. I don't think we have all the answers by any stretch of the imagination. We've chosen this route because it seems to fit with how we want to work as a school. So it's a big, busy school, which causes challenges in itself for all of us on a day-to-day basis, but also then for young people with ADHD, that probably causes additional challenges.
We're going from a class or maybe even year group of 30 students and then a school of maybe a few hundred students to a massive site in a secondary school to potentially thousands of students. That in itself is going to be completely different for a child to wrap their head around.
My son Safiuddin is in year 7.
And my son's in year 9. Well, my son went from, as I say, such a small class to almost 300 pupils in the year. In that first term, it was quite a journey. I can't really describe how difficult it was. Thankfully, the school were, you know, very good at engaging with our family to try and help alleviate and identify what the issues were and how best they could support my son and obviously us as a family.
So we find it really important to extend our transition process for students who maybe do need that bit more support in that way. We introduce them to different members of the team, the teaching team. They also make little booklets all about me and my school and take photographs away with them so that over the summer they can refer back to that.
The work in between his primary school and Rainford was really amazing. That transitional period used to come like once a week at the last couple of months of year 6. He was a bit scared the first couple of weeks. Then probably after 3-4 weeks, he one day said, maybe I was wrong about Rainford, and he just started liking it. He liked it.
It's really important to meet with the class teachers before these students come over, get the background from the teaching staff there and the strategies that are already in place. And it is important that if those strategies are working, we just bring them across and we just adapt them and add to them as need be.
I mean, from the day he started, one of his teacher or teacher assistant will waiting for him in front of the school. It's really amazing. The support from on a daily basis is really, really amazing.
Given that it is a big school, that personal approach and that individual rapport makes a world of difference. And as a parent, I mean, it's fabulous, isn't it?
I mean, it's fantastic.
Really, as parents, we just want a nurturing environment our children can thrive in and be the best that they can be. And I think Rainford High are you know, a long way ahead of other schools in this area.
I feel very privileged to, you know, have a lovely school, have 1,600 great young people who want to come here every day, you know, the 150 staff who work here. It is about being together and working together and trying to generate that hopefully team feeling. We're just trying to make sure that all the young people who come through the doors have a really successful education.